You have to believe in yourself. And just because you don't have all of your answers right now, it doesn't mean there are not answers.
Hello and welcome to the Heal Yourself with me, Sarah Dawkins podcast. We share people who've already healed themselves, along with health and wellness tips from myself.
Hello and welcome back to another episode of Heal Yourself with me, Sarah Dawkins. Today, my guest is Dr. Diana Driscoll, who is an optometrist, researcher, inventor, and the clinical director of POTS Care, the only clinic in the world dedicated to uncovering and treating the root cause of postural orthostatic tachycardia syndrome, or POTS. Diana combined her medical expertise with personal experience to make groundbreaking discoveries around the autonomic nervous system and the vagus nerve. Diana holds 5 patents for her innovations, and she's the author of the Driscoll Theory. Today, she's recognized internationally for her pioneering work that brings science, compassion, and hope to those struggling with chronic, misunderstood conditions. So welcome, Diana.
Thank you for having me, Sarah, and thank you for that lovely introduction. I appreciate that.
You're so very welcome. Now, Diana, you've lived through years of being unwell yourself. What were some of the first signs that something deeper was going on in your health?
Yes, my condition wasn't subtle. It didn't gradually occur. I got a virus overseas, and 2 weeks later, weird symptoms started to occur, and I became almost immediately disabled. It wasn't like I could just push through. I couldn't control my heart rate, my blood pressure. I was trembling. I couldn't breathe. I couldn't sleep. Eventually, I couldn't digest food. Just everything was failing. And ultimately, I was diagnosed with POTS, postural orthostatic tachycardia syndrome. But the doctors had no answers, no help, which was more than discouraging. And then my kids got sick about 1.5 years later, and we were pushed into being incredibly disabled with no one to help. Yeah.
That sounds awful, because most illnesses creep up on us, and we've got the time to adjust our lifestyle. But to be hit with it just like that, and to be suddenly so disabled, so debilitating, and your mental health would have taken a dive at the time, I'm sure.
Initially it didn't. I just kept thinking, this is such a dramatic illness. I'm just not getting to the right doctor, right? So I probably went to 50 doctors, Sarah. I am not exaggerating. And then eventually with the diagnosis of POTS, I was in clinical trials for 3 years because they said I was a flaming case of POTS. It wasn't subtle. I thought, here I am, I'm a doctor. I'm an adult. They'll be able to give me answers. They'll believe me. Nope. They ultimately said, well, we think POTS patients are normal. They're just more aware of their own bodies. What? So the lack of validation can absolutely affect the mental health. But the stubbornness that I felt that, oh no, I knew there was a cause. I got a virus and got sick. So I thought I've got to be in position right now to try to figure this out. Yeah.
Gosh, that's some journey you've been on, seeing all those doctors as well and not getting anywhere. Was it
amount of money put into it?
Yes, yes. And would you say it was their lack of knowledge and understanding, or were your symptoms not clear, or what do you think led to them not being able to help you?
The research in POTS had just not progressed far. And the researchers, when I was sick, were thinking it was just a psychiatric illness, which was ridiculous to me. I knew I could just blow right past that. And then my 8-year-old son got a series of 3 viruses, and each one knocked him down further. So I refused to believe it was anything psychiatric. I didn't suddenly have a, mental illness. I knew it was physical, but it was affecting every system of the body. And trying to piece that apart was so incredibly difficult. And the research to date just wasn't there. They were trying to mitigate symptoms. They would try to slow the heart rate, control tremors, that sort of thing. But I kept asking, but what is happening? What caused this? If we knew that, then maybe the symptoms could improve in the right way. And they weren't really interested in digging into that, which was crazy to me at the time. Yeah, crazy.
And I've seen and witnessed similar as well. I do find that medical doctors are more about what's the symptom and what's the drug that fixes that symptom, and let's put the two together, and then you won't have the symptom, and that's classed as healing, but it's not, is it?
No, it's not. And I mean, I was on the other side. I was a doctor. I'm very familiar with, we label a condition and we treat according to a label, right? But the label of POTS is so misleading. It implies it's a heart problem. We just need to slow down the heart. And it's not a heart problem. The heart is reacting to something. Whatever it is reacting to is the true diagnosis. So as doctors, we need to label things quickly and treat it and get the patient done and out of the room. But the POTS label is just a complete dead end. POTS is not a disease, right? It's just a presentation. Something is making that happen. We need to dig deep and figure out why that is happening. Then the patients actually have a chance of recovering. Yeah.
Yeah, because true healing can only happen when we dig into that root cause analysis. If we just keep treating the symptoms, my understanding is that we'll just express whatever these symptoms were differently, because the
That's
pills
exactly
take away
right.
the symptom.
It's like turning off a fire alarm by covering up the symptoms, but the fire is still burning, right? And it does damage. We have to be able to put out that fire first. Yeah.
Yeah, absolutely. And can I ask as well, you said you also had Ehlers-Danlos.
Yes.
Was that at the same time?
Yes. When I went for clinical trials for POTS, the doctor said, oh, we think you have a connective tissue disorder affecting your collagen. They evaluated that and said, yes, we'll call it Ehlers-Danlos syndrome. I said, well, that's interesting. I didn't even know I was flexible or hypermobile. And I said, what gene is responsible for that? He said, oh, we don't know that. I said, okay, one, why don't you know that? And two, how do you know it's a gene affecting the production of collagen? Could it be an inflammatory gene, a gene that would normally regulate inflammation, and I can't do it, and the inflammation is affecting the connective tissue? Or could it be a gene that affects both the structure of connective tissue and inflammation? But the inflammation is a treatable part of that. And again, they weren't interested in trying to figure that out. So being slapped with a label that implies a genetic issue without labeling the gene was another mistake, right? Yes. So I'm still hypermobile. I'm still flexible, but I'm not sick and I don't have POTS. But they said, well, it's probably the genes of connective tissue and you're experiencing a gradual laxity of your blood vessels over time. Blood's tending to pool and you're developing POTS. So I understand how that sounds right to you. But one, there was nothing gradual about it. I was a post-viral patient. I was almost 50 years old. My son was 8 years old and a virus triggered it in him. And then when I started studying connective tissue and collagen, I recognized that the type of collagen in the blood vessels is different from the collagen that affects ligaments and tendons, that unless I had something like Marfan syndrome or vascular EDS, which I did not, the blood vessels shouldn't even be affected. So then I realized they weren't even thinking through this properly. It was such a superficial label they slapped on it, and it was wrong. So there's so many ways we've gone wrong with this. I had to just throw out all of the labels, POTS, EDS, whatever, just throw them out and try to figure out what the underlying issue was and go from there.
I love that, really love that, because it's all too easy to label something as a diagnosis. And I'm not big into diagnoses because, and I've said this many times, when we get a diagnosis from especially a doctor, somebody in authority, we absorb that as like a computer program into our mind, and then we sort of own it. And then it comes with all the beliefs around it. Oh, well, I'm probably going to be sick and on pills for the rest of my life. And we take all that in too.
Yeah.
So as part of our healing, we have to untangle and undo all of that and disown that diagnosis.
Absolutely. Yes. And for a patient to have to try to figure that out themselves, that's ridiculous, right? It took me 10 years to peel everything back, hence those 5 patents you mentioned. Thank you. And I'm a doctor, I'm an optometrist. I had the advantage of being able to read through medical literature, be able to do studies on my own, et cetera. And it was extraordinarily difficult. I cannot imagine a non-medical patient trying to do that themselves. Yeah, we should not be in position to have to do that. I'm on a mission to change that, Sarah.
Yes, I love that. Thank you. Thank you.
Right.
And can I ask, at what point during your journey did you decide that actually Western medicine wasn't really doing anything for you, and to go off on your own and to do all that research?
Yes, and I'm a big believer in Western medicine, a big believer in the scientific theory, everything. And I worked with the doctors doing traditional treatment for probably 3 years, thinking, well, they've seen gazillions of patients. They know some things. I'm going to trust them. Even though I don't understand what they're doing, I'm going to trust them. But it was when every year I was getting worse, as was my son. And it's when the researcher said, well, we think POTS patients are normal. They just are more aware of their bodies, that I realized we were on our own. If we really wanted to get answers and have a chance of recovery, we were going to have to pull away from every doctor that was trying to help us, which was very difficult at the time. And you're so miserable. But that was a necessary step, to figuring it out. So it was years into it. I walked away from science. I stayed in Western medicine, stayed in the science very deeply, but I went deeper into it than anyone had gone before to figure it out.
Yeah. And like you, I do believe there is a role for Western medicine in things like trauma and emergencies. And, there's so many people have got that need, and it rightly fits their need. But for everything else, we can heal our bodies. We just need to understand what the symptoms are trying to say to us, and to dig into that and find that. So I love that you've done that. Thank you.
Well, Sarah, it's like what you said. We don't want to cover up the symptoms, right? What is the point? And I remember ultimately thinking, if I put anything in my mouth, it's got to be to help with the underlying problem. One of my doctors said at some point I was in a lot of pain. And she said, most of my patients would want something for pain at this point. I said, oh no, I don't want that. I don't want to cover up any symptom, because if I can figure this out, the symptom will improve and it'll give me an answer. And just walked away from all of the symptomatic treatment.
Fabulous. Yes. And we've got to dig in and find out what the symptoms really mean.
Yes, they always mean something. These invisible illnesses, POTS, chronic fatigue syndrome, fibromyalgia, there's many of them. There's always a medical reason for them. And what we had to do certainly is leap ahead in the research to start to look for objective evidence of chronic inflammation. What was that inflammation doing? How is it affecting the cardiovascular system? What other dominoes are falling? With the ultimate goal of not only treating that and getting resolution, but being able to give patients objective markers that they can watch and their doctors can watch for, ultimately with the genes responsible. so that they know they were kind of set up for this. It isn't their fault. Illness is never a patient's fault. And what they can do to control this so they're not sick like that again. Yeah, but to objectify it and then ultimately change the label. The label POTS is terrible. We need to label it based on whatever genetic setup the patient has and the objective markers that need to be monitored.
Yeah. And at some point, you obviously realized that the vagus nerve played a huge role in this. Could you explain that?
I would love to. Stop me if I talk too long on this because it was quite the journey. But I took my symptoms and they were always evolving, as I got sicker. At one point, I had 80 symptoms. And I sat down and tried to step away from the subjective, I'm just horrible, everything's horrible, to objectively, can I cluster these symptoms into one thing that could cause a cluster? And one cluster I had was the organs that the vagus nerve would control. It'd be like the heart, slowing the heart rate, slowing breathing, controlling every aspect of digestion, and interestingly, controlling inflammation. Could that not be working right? Because a lot of my presentation involved that parasympathetic nerve. My digestion had stopped. My gallbladder stopped working. They wanted me to remove it. The ejection fraction was almost nothing. I had horrible constipation with episodic diarrhea, and that ultimately went to gastroparesis. And I developed malabsorption syndrome. I was hallucinating at one point. My son had terrible, very severe osteoporosis. His bones were so fragile, he broke his arm just throwing a ball, just putting on his coat. We weren't absorbing nutrients. And at the time, I was looking at vascular problems at the side of the neck and thought, could that be compressing that nerve? I'd never had surgery that would damage that nerve. And ultimately figured out that the question was, is it a nerve problem? Is the nerve damaged? Is the receptor of that nerve not working properly? Is the chemical messenger used by that nerve, is that not getting released properly, or is it getting broken down? Or is it not even a vagus nerve problem? Is it a bigger problem than that? So the first thing I did was I tested the receptors of the vagus nerve, and they worked great. So it told me within 24 hours that all of the millions of dollars in research looking for some rare autoimmune condition that shut down these receptors, because it looks like that, was useless. The receptors look great. No one figured out how to test them, and that was part of the first patent I got. So with the receptors, I knew we had a chance to trigger a nerve response. And then I sent out symptom checklists for chronic fatigue syndrome, fibromyalgia, POTS, and interestingly, PTSD, that post-traumatic stress syndrome patients tend to present with autonomic symptoms. And I was interested in that. And in those checklists, I tucked in about 30 symptoms of low acetylcholine, the transmitter needed by the vagus nerve, but needed by other things too, like tear production, pupil size, cognition, short-term memory, and found the majority of patients in all those conditions showed the majority of those symptoms. They would come and go to some degree, but the pattern was obvious. And I knew then it wasn't a vagus nerve problem. It was a neurotransmitter problem, and it was affecting more than the vagus nerve. So then I looked at, do we have a genetic disorder, affecting the production of this neurotransmitter? If it's not getting released properly and the receptors work well, could we come up with a drug or a supplement blend that would trigger that receptor and cross the blood-brain barrier and help with pupils and dry eyes, that sort of thing? And spent quite a bit of time on that and figured it out. And I knew immediately that the vagus nerve was working because patients would have a bowel movement as soon as it hit the bloodstream, that nerve was responding appropriately. And then I looked to see if it was affecting more than just the vagus nerve by looking at pupil size. And that got a little bit smaller. And we knew that this is what patients needed. And that's called Parasim Plus. It was a groundbreaking discovery I was very proud of. And then I just grew from that and looked at that autonomic nervous system, the genetics involved, the whole bit, to try to maximize that. And then ultimately, ultimately figure out why was that not getting released properly, right? And figured that inflammation was blocking it. And in every case, it can be a little bit different, but we need to identify ultimately that inflammation and help the patient with that, and they can recover. Yeah. So it was about a 3-year journey. It wasn't a quick sit down.
No,
Right.
no, I'm very involved as well. And were you testing yourself with the supplements and
Absolutely.
so
You
you
bet
were
I was.
your own guinea pig.
I was. And then I had 2 lab rats at home, my kids. So I would look for a nerve response in myself. And when I was getting it right, I gave it to them. And then I fine-tuned it over time. Yes. Because we don't want it so strong that the receptors would just shut down, that there's too much neurotransmitter. There were some things I really had to watch and get the balance just right. So it was a little tricky, but I love a medical puzzle. Organic chemistry was one of my favorite subjects in college. So I sat down with the genetics that I had been studying and digging into, and my organic chemistry knowledge, which was a gazillion years old, and tried to put that together and figured it out.
That's fabulous. Thank you. So what did healing look like for you as you started to see results? What was going on? What changed?
Yes, and there were quite a few steps, and although every patient with POTS or chronic fatigue or what have you is different, I will say I was different from my kids, they were different from each other. There are some commonalities, and it took me 10 years to figure them all out. But with the patients we see at POTS Care, we don't take 10 years to figure it out because we know these commonalities. And then we look for the differences in patients, and we can figure out a prognosis and a treatment plan. But the commonalities, I published these in the Driscoll Theory almost 15 years ago. And I think it's probably still new for a lot of people. It's the same commonalities with post-COVID, where we saw a propensity to develop high intracranial pressure. The neurotransmitter for the parasympathetic nervous system wasn't working well. That's where Parasim Plus came in. And then the inflammation was affecting the cardiovascular system. Cardio, the heart, was responding. Vascular, in that the inner lining, the endothelium of the blood vessels was getting damaged, and that was contributing to POTS. And then finally, oxidation was affecting patients fairly dramatically. Oxidation always comes with inflammation. There's never an exception. But the oxidation continues that inflammatory process, both for the blood vessels, the heart, ultimately organs. And interestingly, it changes our brain chemistry, where we get more glutamate, patients' anxiety can increase, and sometimes it exhibits like anxiety. Oftentimes, and pretty much across the board, it exhibits as almost an OCD, attention to detail. Patients like things a certain way. We're very high achievers. Unless we're too sick, we're at the top % of everything we do. It's a very smart group of people, but you need to control that oxidation or the inflammation continues. So another supplement I came up with, NAC Max, to affect the oxidation. So again, we can start with those commonalities to help patients and then dig into where the differences are, and patients can get complete resolution. Yeah.
So as part of your healing, then you developed these supplements, finding that that actually there was a nutritional deficit, if you like.
It
As
ended
in,
up with a nutritional deficit because the vagus nerve wasn't working well. So stomach acid production was down, the gallbladder wasn't working, pancreas was struggling. And then because the motility was affected, digestion wasn't normal. And so without digesting the food properly, I couldn't absorb the nutrients right. So the lack of nutrients wasn't from lack of eating properly. I did fine there. So did my son. But we couldn't break down the food to absorb those nutrients, right? We get the vagus nerve working, the parasympathetic nervous system, again, Parasym Plus did that. Then we can start absorbing nutrients again. Imagine that. I needed a ton of vitamins for a while because I was just absorbing a little bit. But then ultimately, I didn't need vitamins. I got those from the food, like normal people, right? Which was great. But in POTS care, we see everything from, like, I was experiencing hallucinations. We see pseudo seizures, osteoporosis. Patients can be incredibly ill just from the lack of nutrients. But doctors don't know to look for that. Blood tests aren't always accurate for that. And unless we're alcoholics or celiacs or Crohn's or something, and if we're eating properly, we don't have an eating disorder, then why would they think we have nutrient malabsorption? They just didn't go there. But we corrected at the source of the problem, and that normalizes all by itself.
superb. Thank you. And if somebody's listening to us now and they feel dismissed or misdiagnosed, what would you recommend for that person?
Yes. One, trust your body, trust your instincts. We know as patients when something is wrong. And it was shocking to me that I was a doctor, an adult, a fully functioning human, and in 2 weeks was disabled, and I was still not validated. I was shocked by that. And I think, what if I was like a 13-year-old girl or something, you have to believe in yourself. And just because you don't have all of your answers right now, it doesn't mean there are not answers. So never give up hope. Your answers might be right around the corner, right? And I think that's number one. We have to hang on to hope. The autonomic nervous system, my specialty, is something that doctors don't like. We can't see it. We can't measure it. You have to figure things out by presentation. So look at, is your parasympathetic nervous system working properly? Your digestion, pupils, cognition, that sort of thing. And if not, that's what Parasym Plus is for. We can put that back. We can control oxidation with NACMAX. And then if it's POTS, the cardiovascular system is affected. There's a reason for it. Somewhere there's a reason for it. Yeah.
Wonderful. That's great advice as well. Trust your body, because we've been conditioned to give over the responsibility of our body to medics and hospitals and nurses.
Yes. I feel very fortunate, Sarah, that I got sick before my kids got sick. If they had gotten sick first, I wonder, would I have thought maybe they are just, woo? I don't think so. But I was very fortunate to be in the body of a patient and know that there was a medical reason no one was figuring out yet. And then when that was corrected and all the dominoes that have fallen from that was corrected, then the mental health corrected, right? And my kids could lead a normal, fulfilling life, as could I. But if I had not gotten sick first, I wonder if I would have been taking them to a psychiatrist ultimately, which was what was recommended, right? Yeah. I just walked away from that. No, well, that's wrong. Yeah, we've got to dig deeper. Mm-hmm.
Yeah, and it is so easy to trust the doctors because we believe that they're in that position from all their training and from they've earned that position of authority. But it's also easy to have that tunnel vision as well and only trust the doctors and not actually step back and come back into our body and listen to that.
Yeah, well, my goal really is to change the labels that patients are dealing with. as long as we have labels like POTS or chronic fatigue or what have you, doctors are never going to have to, are going to be able to pick through those conditions to figure things out, nor should they. That's not their job, right? But we need to change the labels, objectify it, so we have measurements we can take, labels according to the measurements, a treatment plan, prognosis, and doctors can do that. So the research in chronic inflammation, when I was going through it, was in its infancy, but that's where we went, right? Now it's progressed, which helps. And honestly, COVID kind of helped with that. It helped explain this inflammatory POTS, this inflammatory reaction. We need to identify and treat that. And then patients won't be not validated anymore. They'll have a proper label, and the doctor will say, oh, this can be really significant, unless we treat this properly. But right now they don't have it, and it's a terrible position to be in for most patients. It's terrible. Or they're told it's genetic, they're just going to have to live with it. That's crazy. There's no possible way I could have lived with this condition. I ended up bedridden for years. I couldn't live with that, and I couldn't let my kids be trying to live with that either. Right. Yeah.
Thank you. And once you started understanding the root cause of POTS and Ehlers-Danlos and chronic fatigue, how long did it take you to actually make your recovery?
Yes, because it was so spread out. It was 10 years, but it doesn't take patients 10 years, right? It took me 10 years because I had to figure it out as I went. So the first thing I figured out was the high intracranial pressure and was able to treat that. That was a significant help. The next step was Parasym Plus for the autonomic nervous system. Tremendous help. Then the next step was the oxidation, tremendous help. And then ultimately the cardiovascular system. What can we do to help blood vessels, help the heart recover? So each one of those layers, it was probably 2-3 years in between because it took me that long to figure it out. With the patients we see at POTS Care, generally speaking, we'll tell them 8 to 12 months for about to get about 90% there. It doesn't mean they're horribly miserable, for 8 to 12 months, they start to improve. But there's a fair amount of repair that needs to take place. By the time a patient gets to POTS, they're significantly ill. Yeah. So 8 to 12 months is not unusual. For me, it was 10 because I didn't have help. Right?
Of course. And you were doing the research as you were doing your healing as well. And I'm a big believer in the body heals when we support it.
Yes.
And I've said to many people, we've never been deficient in a pharmaceutical. We've been deficient in other things, but never a pharmaceutical. So thank you for all the work you've done and all the patents you've got.
You are very kind. I would never have wished this journey on anyone, but it was such a long and horrible journey for us. Now the empathy that I feel for patients, it never goes away, right? I do not want to see anyone have to go through this. So yeah, I'm here to help as much as I can. Yeah.
And thank you for that, Diana.
Thank you. And thank you for amplifying my voice. I'm just one voice, but there's so many people who are sick and they really shouldn't be. This should have never happened, honestly. Yeah.
Absolutely. And I agree. But, I think we've got to advance the understanding of like the everyday person who, like myself, my first port of call was a doctor and a diagnosis and a prescription and a pill. And I lived that life for 42 years because that's what my beliefs were, because that's how I was raised. It was only after going through my own healing, I realized how powerful our bodies are and what we're truly capable of. And if you'd have said that to me before I'd have done all of that work, I just wouldn't have believed you because it wasn't in my belief system.
Yes, no, I totally understand that. I think those of us too who are kind of genetically set up for the inability to control inflammation, such as myself, it's not our fault. I was a big exerciser. Nutrition was like a hobby of mine. I was extraordinarily healthy, and I still got sick. I couldn't stay on top of it all by myself. But with addressing it properly from the inflammatory component, allowed the body to do what it's designed to do and allowed it to heal itself. It took consistency to stay on top of it, to not give that inflammation a window to come in and do damage. But as long as I protected myself from the inflammation, the body could heal. And even an old person like myself could recover. And certainly children, they have powerful ability to heal. Yeah.
Yes, they do. But as do we all. I mean, why should we let age be a barrier? And I think that, again, is another conditioning. Because our cells are renewing all the time. Why do we need to then accept that old age, in air quotes, is the cause of our health problems?
Thank you. Hugely agree with you. There were some people who along my journey said, well, you're getting older. I thought, well, that is not why I'm sick, And now I'm so proactive, Sarah, because I'm very active. I want to stay that way. I want to stay cognitively healthy. And I have a feeling that if we all learn how to stay on top of these things, these old age illnesses won't be a thing, right? Chronic inflammation is a huge part of aging. We call it inflamm-aging. Why aren't we on top of that so that we don't go through that? I think it can be done. So yes, never accept, well, you're getting old as a reason for illness.
Yes, truly. And thank you.
Thank
so
you.
Could you give our listeners one tip that they could work with today for themselves? Anybody going through POTS or Ehlers-Danlos or any of the symptoms that you've had?
Yes. Boy, this is so hard to pick one thing, right? Again, I think that the most powerful thing patients can do is remain hopeful. Hope is a very powerful thing, right? If we give up, we don't have a chance. So remain hopeful no matter how bleak it looks. I remember thinking at times, I just can't get out of this. This is it for me. And then I would change one thing, like go for a walk. And, oh, I'm back at it, So you never know when your answers are right around the corner. If you're sick, movement really is helpful, and you do whatever you can do. When I was bedridden, I came across an article that said, if all you can do is wiggle your toes. Thought, oh, I need to take this more seriously. And then as you can do more. The body is designed for movement. So never give up hope. Movement if you can. And remember, there's always a reason for illness. Always.
And that's so profound. Thank you.
You're so welcome.
And where can people find you, Diana?
I'm at potscare.com, and I established a Patreon account called POTS Rebels, where we are rebelling against traditional treatment. And I'm putting all the information I can about how to address these conditions in that. And then I meet with patients or caregivers every week or two to answer questions, discuss topics, so we can hopefully spread more word to patients. So I'm on Patreon too. I'm elsewhere, social media, every place else. But POTS Care will usually get you to me.
That's fabulous. Thank you so much. And I'll put all that in the show notes as well. Thank you so much for sharing your expertise, your healing, your knowledge with our audience.
Thank you for sharing it too, Sarah. I appreciate you so much. And thank you for the honor of being here. Really, it was great.
My pleasure.
Thank you for listening. Please share this podcast with anyone who you think will benefit. And can you leave me a review wherever you've listened to it to help me reach more people? Thank you.